Hello, and welcome to this mini-gem from the Association of Elderly Medicine Education. I'm Peter Brock, and today I'll be talking about tips for new docs, starting as a Geriatrics FY1. The goal of this mini-gem is to try and help junior doctors with their placement on geriatric medicine. I'm going to identify why geriatrics is different to other medical specialities, and how to make your most of your placement for the benefit of you, your colleagues, and your patients. It won't be a list of conditions and how to treat them. These are covered better by other mini-gems in the series. Instead, it will give an idea on how you should approach your geriatric patients and your ward work to make the most of it that you can. Firstly, congratulations. You have the best job a junior doctor can do. It's full of variety, which will keep you interested on your ward and help you with your on-calls. You'll often come across things that you've seen on your ward before. There's excellent continuity, with your patients often having long stays that you can input in and really make a difference to. There's great teamwork, which we'll discuss more later on, and there's also high quality supervision. There are often multiple junior staff, registrars and consultants who are committed to their ward patients. So how do you approach your geriatrics patient on the ward? Well, the first thing you often approach will be the huge pile of notes that commonly comes with them. These patients are complex, but this complexity is not to be ignored. You need to embrace it to deliver quality care for your patients. Take the presenting complaint of a fall. Simple enough, but there are many things that can contribute, and all of these may need to be addressed to prevent a fall occurring again. Consider and highlight to your seniors the complexity of a patient's presentation, particularly when you're initially assessing them. Highlight all the things that contributed to their hospitalisation, and you will improve from the moment that they enter the ward the quality of their care, and impress your seniors. Now, your patients are going to have extensive past medical histories. Do your best to try and get details of ongoing treatments, particularly in cancer and psychiatric problems. Note who cares for them so you can contact them if needed, and correlate their current conditions with their medications, so you're able to answer your consultant's question when they ask, why is this patient on this medication? Now, a hugely important and rewarding part of your patient's care is gathering collateral histories. We've discussed this in detail in our Tips for New Doc COTIcast, but I ask you, please consider all these sources of information. Start gathering information straight away, and you'll get to the root of problems quicker and deliver more effective care. Your patients will often be on a cocktail of medications, sometimes which can be contributing towards the problem. Dr. James Fisher has created a mini-gem entitled The Geriatrician's Scalpel to discuss the variety of pitfalls in prescribing for elderly patients. I've highlighted 4 groups of drugs in particular that you should have serious reservations about starting in the elderly. When you come to assess your patient, your senior geriatricians will talk of comprehensive geriatric assessment. What this means to you is considering the patient beyond just their presenting complaint. Look at this list, the variety of things that are on it. Use it as a geriatrician sieve and try and consider all of these factors when you assess them, particularly if you're doing the ward round that day. You'll make a difference to that patient's care in a way that will help them get better quicker and keep them out of hospital for longer and improve their quality of life. Now, as an FY1, you're likely to be responsible for checking and acting on people's blood results and investigations. In elderly patients, you will pick up pathology that you were not expecting, anything from anemia to cancer. So flag up an unexpected abnormal result with your seniors. You might also be asked to perform some basic screens, and I've detailed them here just to avoid any confusion. Ultimately, you can be left with multiple issues with one patient, and junior doctors can often find it useful to create what's called a problem list. That way, multiple issues can be focused on, followed up, and don't get lost over the course of the admission. You're often the doctor that has the most time with these patients, and it can often fall to you to remind your seniors about issues that were previously thought about but now have fallen on the wayside. Bring them up again, and once again you'll improve your patient's care. Now to discuss 2 of my favourite parts of being a geriatrics junior. Firstly, working with your multidisciplinary team. Looking after these patients truly is a team effort. Your patients won't get better or leave hospital without some of the people listed here. Enjoy working with your team. Keep in regular touch with them. You are often the person who knows what everyone else's role and input is, and that way you can act to coordinate this team and help with this patient. Secondly, and probably most importantly of all, you are the doctor who gets to spend the most time on the ward with these patients and their families. That means you have the opportunity to make the biggest difference in that patient experience. A few tips here. Try and keep them and their family as informed as possible. It's invaluable information and will often be a great source of comfort, particularly in a prolonged hospital admission. Ask them questions about their lives unrelated to medicine in those moments while you are taking bloods or cannulating, and you'll discover fascinating insights into this patient's life. Try and always ask them if there's anything you can do to help before you leave the bedside. It might be as simple as helping get this patient to the toilet or getting them a drink, but it's going to make a difference to their care and the way you look after them. And finally, you will be called upon to be an advocate for these patients, particularly when you're requesting information or care or input from other doctors. Know your patients and you'll be a good advocate for them. So in conclusion, know your details. These patients are complex, but embrace that. Work with your MDT and enjoy doing it. And finally, as much as possible, interact with your patients, and you'll enjoy that too. I've listed references here that include a variety of mini-gems that have already been produced, a Coty cast called Old Tricks for New Dogs that discusses many of these points in more detail. I'd also encourage you to take a look at Sean Ninan's blog on 21 tips for junior doctors working with older people. It really is an excellent read. And finally, if you have any more interest in comprehensive geriatric assessment, please check out this document from the British Geriatric Society. Thank you very much.